Good afternoon, and welcome to Pre-Roe Action's Act and Learn webinar for the month of September 2022. We are really excited to partner up with our esteemed colleagues at Jane's Due Process to talk about abortion care for young people. So first, we'll introduce your host from the Pre-Roe Action side. First voice you're hearing is Erin Matson. I use she, her pronouns. I am co-founder and executive director of Pre-Roe Action. I'm based in Washington, D.C., and you can follow me on Twitter at Erin to the Max. And I'll let Audrey do their own introductions.
Hey, y'all. My name is Audrey Gao. I use they, he pronouns, and I'm the campaign coordinator at Pre-Roe Action. I'm based in Dallas, Texas. And you can follow me on Twitter at Audrey Gao _. Thank you. Or Audrey _Gao. My bad.
Awesome. Thank you. Okay. So quick overview of the agenda and what we'll talk about today. We'll briefly introduce Pre-Roe Action. Then we'll do an introduction of the topic. And then we'll go into presentation by Jane's Due Process. And we're really excited to be joined by Eleanor Carano, who's program manager, and Serena, a youth fellow with Jane's Due Process. And then we'll move from there to next steps and Q&A. And okay, so a few housekeeping matters. First, for Q&A, if you have questions, just put them into the questions tab at any time during the presentation. We'll get to as many as possible at the end. You do not have to wait to the end to put them in there. And then also in terms of live tweeting, if you do like to do that, you're welcome to do so, and just use that hashtag Pre-Roe Action. And thank you much for that. So who are we? What is this organization? Pre-Roe Action leads bold action to increase access to abortion and advance reproductive justice. We're fiercely proud of our left flank analysis. We have a willingness to hold folks on all types of issues accountable, whether they're traditionally considered allies or opposition. So no matter who you are and what you say you believe, if you are standing in the way of access to abortion and standing in the way of full reproductive justice, we are going to come for you. We have a commitment to nonviolent direct action as one of the tools in our toolbox. And I just want to parenthetically say something that delights me to no end. We have always been an all-virtual organization. We're a national organization. So everyone has always worked from home. And it just so happens that we have now reached a point where fully 1/4 of our staff live in Texas. So just strong solidarity with folks in Texas who are seeking to access care in this government-made disaster. So with that, I will pass it over to Audrey.
Okay, great. So we just wanted to provide some background context to kind of set the stage for this webinar, which is going to focus on youth access to abortion in the United States, particularly in abortion restrictive states. So as y'all surely know, after Roe v. Wade was overturned this summer in the Dobbs ruling, abortion lost its federal protection, opening the door for anti-abortion state legislators to pass even more abortion restrictions and bans. And I also really want to note too that this is changing almost every single day, but we just wanted to provide a small snapshot of what's happening right now. So since Dobbs was released in late June, 17 states have full bans or restrictions up to 20 weeks, and we expect more to follow. And for a more up-to-date view, I would suggest checking out our colleagues over at the Guttmacher Institute. But ultimately, this results in a very confusing patchwork of abortion legality and struggles to access abortion in all states. So it's really hard to navigate and access care without fear of criminalization in abortion restrictive states, even though there are claims by anti-abortion advocates that abortion legislation will primarily affect abortion providers and those that offer assistance in accessing care. These anti-abortion laws actually create a culture of fear that prevents many from accessing necessary care, including other reproductive health care services besides abortion. And we also wanted to note that it's hard to access care in states even without abortion bans or really restrictive laws because of wait times, which are now a challenge like they have never been before due to the amount of patients coming in from other states that may have more abortion restrictions. You can go to the next slide, please. So I also wanted to provide an overview of parental involvement laws and judicial bypass legislation because we're talking about youth access to abortion. And this kind of legislation uniquely affects minors. But I also want to say too, this is just an overview. Jane's due process will go into much more detail about it. But currently 36 states have parental involvement laws, which require minors to get parental consent to obtain abortions. This legislation is often falsely labeled as so-called protection against minors being coerced into getting abortions, but they actually serve as logistical and financial barriers to minors accessing abortions and freely exercising their bodily autonomy. Of those 36 states, 35 states have judicial bypass legislation, which is a way for minors to access abortions without parental consent, often through an alternative legal process done through the courts. Unfortunately, many of these laws are null due to overall bans in effect with states that have lots of abortion restrictions. Next slide, please. So overall, youth access to abortion was already really difficult, but now it's even harder, especially in abortion restrictive states. It's heavily impacted by this stigma against young people seeking abortion care. This existed before the fall of Roe v. Wade, but now with the increase in abortion restrictions and bans, it's even worse. And we also wanted to note too that not only is there stigma, but now there are concerns of criminalization against minors seeking their own abortions. And unfortunately, we're already getting accounts of minors getting charged for that in this post-Dobbs and post-Roe landscape. Youth access to abortion is also impacted by this narrative around conservative parental control in education and healthcare, in which parents believe that they should have complete control over what their children learn and what kind of healthcare services they can receive. So we can link this fight to abortion access for minors to fights over so-called critical race theory, comprehensive sexual education, and trans rights. And lastly, access to abortion care is also affected by the anti-abortion movement's fear of the white supremacist replacement theory, which is a far-right desire to increase the white population in the United States over the fear that the white population will be outnumbered by people of color within a certain time period. So we just wanted to provide this context for our discussion today with Jane's due process and to show that abortion care is healthcare for all ages. So we're really excited to have Jane's due process on to showcase their services and show how we can safeguard abortion care for all.
Thank you so much, Audrey. That was dispiriting and heavy information that you shared, but it's really valuable, and I'm glad that everyone on the line is getting that download. So I'm going to do a brief introduction of our two panelists, and then we'll turn over the reins to them, and they will walk us through their presentation. First, we have Eleanor Grano, who uses she, her pronouns, and she leads Jane's due process's youth advocacy work at the Texas legislature and online using TikTok, Minecraft, and Instagram. And sidebar, Minecraft, that's awesome. She provides youth advocates with deep and meaningful guidance and support to feel truly cared for and empowered in this work. And she centers youth voices in reproductive rights, health, and justice spaces in state and national coalitions. Welcome, Eleanor. So glad to have you.
Thank you so much, Erin. I'm really glad to be here today, too.
Excellent. Well, we are so glad to be working with you today. And also really pleased to introduce Serena, who uses she, her pronouns. And Serena was a former Jane's Due Process client back in 2020 and is now part of the Youth Advocacy Fellowship at Jane's Due Process. And welcome, Serena. So glad to have you.
Thank you. I'm very glad to be here.
Great. Well, we are thrilled to have you both. I'm just going to let me know when to go next slide, but I will pass this over to the two of you.
Thank you so much. Welcome, everyone. Today we're going to be talking about reproductive rights of teens in Texas. Both myself and Serena will be here to discuss that with you. Next slide, please. So a little bit about Jane's Due Process is that we help anyone under 18 in Texas navigate parental involvement laws for both birth control and abortion, and to be able to access care confidentially. In 2021, we actually served more people across the state than ever before through our hotline. So we receive about 2,500 calls a year. We receive about 305 of those calls result in judicial bypass intakes. And then we get about 2,600 to 3,000 texts a year. And then we distribute about 380 repro kits a year too. I think that number will be a lot larger because we've now scaled our emergency kit distribution program, where we deliver about almost 100 a month in Lubbock, and we're getting to 50 a month in College Station. So we're really excited to have expanded that. So we should see a larger distribution of emergency contraception to Texas teens. Next slide, please. Serena, do you want to take this one?
Yes. So our hotlines are 100% volunteer driven, and it's available 24/7 every day from 8 a.m. to 11 p.m. So volunteers are trained on the reproductive rights of minors, including non-coercive options such as counseling. All volunteers have access to interpretation services to help callers who do not speak English. So young people can call or text our hotline to receive information and referrals for abortion, pregnancy, birth control, STI testing and treatment, and other reproductive services as well. Next slide, please. Okay. So in 2018, we developed a leadership program, or JDP developed a leadership program for their clients, and they wanted to center youth voices in legislation that directly impacts adolescent sexual and reproductive health outcomes. So prior to this cohort that I'm participating in right now, JDP youth leaders have testified in front of the United States Congress, the Supreme Court of the United States, and have been fact witnesses for parental involvement lawsuits and more.
Thank you so much, Serena. Serena is also part of our youth advocacy program. And in this youth advocacy program, we support our callers who want to get involved in advocacy. We pay them $1,500 a month for 2 years to really give them space to grow in their advocacy and have capacity. So that Serena is part of our youth advocacy program, and we have 4 former clients in our youth advocacy program, which is a cohort that lasts 2 years. So we're in our second cohort. With that, I'll go into birth control laws in Texas. Next slide, please. So with birth control laws in Texas, it was in 1998 that Texas passed its first parental involvement law that required parental consent for contraception for STI testing and treatment. So this also includes minors who are already pregnant and parents. So for example, if a parenting minor can consent to all the health care of their own child, but they still need to ask for permission from their parents to get things like IUDs or any type of birth control, the HPV vaccine, they still require parental consent. And that is just like one of the most frustrating parts of that law is that even parenting minors still are not allowed to consent to their own health care. But this law is not unique to Texas. There are about 25 other states that require parental consent for birth control too, which makes it really difficult for minors to have, control over their own reproductive system. Next slide, please. So we're going to be discussing different loopholes in this law. But before we go into it, it's really important to know the difference between consent and confidentiality. So consent allows someone to act and access a certain service, and confidentiality means that it is kept private, that it can be kept private from, the information can be kept private from parents, and doctors have a wide discretion on whether or not to inform parents. That said, it's really important to know that the majority of teens include their parent or a legal guardian in decisions about their sexual and reproductive health. However, for certain teens, having the option of confidential services makes it more likely that they will be able to seek care when they need it. So that's why it's supported by the Society for Adolescent Health, as well as other health organizations, because it just improves access to young people, just knowing that they can access the care when they need it without fear of being kicked out of their house for asking for support. Next slide, please. So one of the first loopholes to this state law is following the money. So if a clinic receives federal funds like Title X funding, they are allowed to act in accordance to federal law, not state law. So so that's why Title X clinics are so important in Texas, because this allows for teens to get birth control without permission from a parent, PrEP without permission from a parent at Title X clinics, because it follows federal law, not state laws. And there's not a federal law for minors to get permission from a parent for birth control. I think one of the most unique things about Title X funding that most people don't know, and I think it's kind of funny, is that it was actually introduced by President Nixon. And it was dedicated to providing comprehensive family planning services so that anyone, regardless of background and insurance and access to insurance, could all have control over their reproductive lives. So I thought that was like really, it always shocks me that it's Nixon who passed Title X funding. There are about 175 Title X clinics across Texas. And the other thing important to know about Title X clinics is that you don't have to be a US citizen to access services at these clinics. So for example, outside of minors, if you know someone experiencing intimate partner violence, and we know with intimate partner violence, there's a lot of withholding of access to insurance, there's withholding of IDs. If someone goes to a Title X clinic and does not have an ID or have an insurance as an adult, they can still get care at a Title X clinic. And I think that's really important to know, as you know, reproductive health and intimate partner violence is often interconnected in a lot of ways and intersects in a lot of ways in our movement. Next slide, please. So how can teens get birth control at Title X clinics? The first is you go to OPA FPF Clinic Finder. If you go to this website, you'll find the nearest Title X clinic to you. This is good for anyone, even people outside of Texas. You'll enter your zip code, and then you'll call the Title X clinic closest to your zip code, and you'll want to say, I want an appointment for confidential birth control. I don't have any money and I can't involve my parents. It's really important that you say it in this way, because a lot of times when you call a Title X clinic, many of the front desk staff aren't aware that they're a Title X clinic, because it's kind of like speaking to someone in the weeds, right? People don't know where their funding sources come from at each clinic. But if you say it in this coded language by saying, I want an appointment for confidential birth control, I don't have any money and I can't involve my parents, it'll click off all the checks in their head that they'll know how you qualify for it. They won't know necessarily the term Title 10. I'm happy to answer questions if anyone has questions on that. But next slide, please. So the other option for teens to get access to birth control at a federally funded clinic is Medicaid clinics. And Medicaid clinics were established Medicaid was established in 1965, but Texas began participating in 1967. It's really important to know that for low-income people to qualify Medicaid, it's really hard. So for example, a single parent family, like a mother and a child, would need to make less than $300 a month to qualify for Medicaid in Texas. Which is really hard, right? Like you would have to, it's a great possibility that you would not have a house or a place, housing, which makes it really hard for people to cover it, to get Medicaid. But Medicaid is one of the options for people to get birth control without parental consent. All foster youth are placed on Medicaid. It's called Star Health in Texas. It's really important to know that even for foster youth who are on Star Health, this is where it comes into the conversation of confidential versus being able to consent. So with foster youth, the people who their placement do have access to their portal, right? So they can see what visits they're at. They can see like what the appointment was. They get the EOB, the explanation of benefits, so they can see why their foster child went to the doctor for, what they were seen for, and what they got support with. So we know a lot of times that placements do not want to provide housing for sexually active young people. So this is another thing where it can still jeopardize the young person's housing situation if they are if they cannot access confidential care. But then what about the other thing to know about is that Texas didn't expand Medicaid, so there are about 5 million people that are uninsured in Texas. So even if they got the ACA, their parents, some of those bronze plans still cost about $300 to $500, and that's not even for a child. So it can be still really expensive because they don't make enough to be able to afford the Affordable Care Act, and they make too much money to qualify for Medicaid. The other thing to know about Texas is that we do have the Children's Health Insurance Program, but that does not cover birth control. To qualify for the Children's Health Insurance Program in Texas, I think your parent can make about $1,500 a month, but still, even if that parent gave consent to get birth control under the Children's Health Insurance Program, they still will not be able to cover birth control. Texas and North Dakota are the only two states that refuse to cover birth control even with parental consent on the Children's Health Insurance Program. And even if like the minor has like fibroids and has a medical condition that requires the prescription of birth control, because the reimbursement process is so hard that many providers just refuse to cover any minor on the Children's Health Insurance Program with or without parental consent with a medical reason, and they just won't cover birth controls because it's not worth fighting the reimbursement process with Texas. So with that said, minors getting care is really hard to access birth control in Texas. There's a lot of birth control deserts. It's really hard for rural Texas teens to be able to confidentially access birth control because of all the ways that Texas makes it difficult for poor people to access health insurance and specifically reproductive health. Next slide, please. So we've been talking about Title 10 clinics and Medicaid clinics. Those are the special qualifiers that are the loopholes to be able to access birth control in Texas. But we also have a few special qualifications. So for example, if a young person is married, they can consent to their own birth control, which is really wild to think that a young person has the right to get married, but doesn't have the right to consent to their own birth control. They can sign up for the armed forces as a minor, but they still cannot consent to their own birth control. They can also say that they're age 16 or older, living on their own and managing their own finances. And that is another loophole if they're not legally emancipated. Next slide, please. So how do teens qualify for this special qualifier? This website on the Planned Parenthood website gives like a example of like a box that you would check, but this box that you would check is available on any doctor's intake forms, and it's usually at the bottom, and it'll say you check off the box, and that you'll tell the clinic that you're 16 or older, you live on your own and can consent to your own health care. It's really important that no extra documentation is needed to provide proof that you're living on your own. This is a Texas family code. Like under this law, they're allowed to consent. But that can still be intimidating, right? Not every young person feels confident to tell the clinic that there's this Texas family code law and that if they are living on their own, they can still consent, just because it's so nuanced and because a lot of times front desk staff don't believe minors, especially when they are, like correcting them on the law in regards to their health. Because what we find is that just a lot of people feel uncomfortable about talking about young people having sex. And with that comes like fear that minors have like no bodily autonomy whatsoever. So like they immediately shut down a conversation around it. Next slide, please. So if a young person can't get to a Title X clinic, if they can't get to a Medicaid clinic, if they don't qualify for any of those special qualifications, the other resource in Texas that's available to young people is where they can get free condoms and lube. TexasWearsCondoms.com will mail free condoms to anyone in Texas. They usually sell out by the middle of the month. So if you or someone tries to access it at this website, just know you have to keep checking and check at the beginning of the month. You can also follow them on Instagram or social media. They usually update when they're back in stock, and you can get them that way. For Halloween, they sometimes also have glow-in-the-dark condoms too, so that could be fun. Once again, they sell out by the middle of the month, and so you just have to go back to their website once they restock, and it's free 100% for anyone living in Texas. Next slide. So as a result of this complicated system for young people to access birth control in Texas, we have started this distribution program where we deliver free Plan B, as well as pregnancy tests, condoms, and a reprosine. This one needs to be updated because Bridge Collective is the one that delivers in Austin now, and James Due Process delivers only in Lubbock in College Station, and we are hoping to launch in San Angelo in January 2023. There's also a few other orgs that have started delivering free emergency contraception. We have the Dallas Liberation Movement in the DFW area, Buckle Bunnies in San Antonio and Corpus Christi. And yeah, so because there's so many different barriers to access emergency contraception, we've tried to make it more accessible to young people in being able to deliver it or having it mailed, because just the cost of Plan B can be a prohibitive towards many young people. Next slide. So here's some other organizations that are delivering in South Texas. There's South Texans for Reproductive Justice. There's Frontera Folks in El Paso. We also have a blog post on the JDP website that has every person that delivers free emergency contraception in the state and how to access it. It's always updated And we also have, I think, a carousel post on our Instagram that educates people on it as well. Next slide. Some other tips is that I know we all hate Amazon, but Amazon provides the most affordable emergency contraception online. It's $8, which is, when we tell most young people that, they just think that everything is $50, and that's because they go to Walgreens or they go to Target, which is where the name brand Plan B is sold, and they don't sell the generic brands. But so you can order it on Amazon. If you're concerned about a package of Plan B coming to your house, you can ship it using an Amazon locker, and that way you can walk into a 7-Eleven or wherever an Amazon locker is and get your package, and no one knows why you went in there. So it's a really great option. There's also Costco pharmacy. They sell it for $10. Costco does not require a Costco card to access their pharmacy, so that's a same-day option as well. Also, always look at places like Walmart or H-E-B or places that sell generic versions. And if you don't feel comfortable going to a store, you can always use a drive-through pharmacy, curbside pickup, or like an app like Postmates. Next slide. And then I'll hand it over to Serena, who will talk about abortion laws.
Yes. Next slide, please. Thank you. So before SB 8 was passed, there were already many restrictions in place for young people and minors when it came to abortion. So that included parental involvement laws, mandatory 24 hours, that waiting period before or between, state mandated ultrasound and abortion care. So they just had many restrictions in place. I remember I got my abortion as a minor before SB 8 was passed, so I definitely remember all of these restrictions. They also had ban on public and private insurance from covering abortion, which, as you can imagine, that can be very hard as young people may not have a job, or if they have a job, they're not making enough to have their own insurance, right? Abortion providers are also required to offer the option of viewing the ultrasound image or listening to the fetal heart tone, which is like, why would you do that to anyone really who's pregnant and obviously knows that they want an abortion, right? So it's things like that were already in place before SB 8. And we say that to say that we didn't just get to where we are now when it comes to the abortion restrictions in the United States, period. There were things in place before that led up to what happened back in June. Okay, so there were also requirements for abortion providers to distribute anti-abortion materials and conduct state-directed counseling that is anti-abortion. So they would give us pamphlets. I remember they gave me a pamphlet with all of my other options besides abortion, even though I was obviously there to get an abortion. So I definitely remember that as well. And in March 2020, there was an executive order that deemed abortion as an elective surgery that effectively shut down clinics for the first month of the pandemic as well. Next slide, please. So SB 8 was passed by the Texas legislature in May 2021, and then it took effect on September 1st, 2021. The law prohibits any abortion care after 6 weeks, and it is enforced by private citizens filing civil lawsuits, not state officials. So basically, many people, birthing people, many young people, anyone really, they don't know that they're pregnant by 6 weeks. Usually we find out way after that. So as you can see, that was obviously an issue. Next slide, please. So on June 24th of 2022, in a 6-3 decision by Justice Alito, the Supreme Court held that the United States Constitution does not confer a right to abortion. And Roe v. Wade and Planned Parenthood versus Casey were overturned. I'm so sorry. And abortion restrictions are now determined by the states. So they basically left the decision up to the states to figure out what they want to do with, people who are able to get pregnant. And they just left the decision to the states, which is very crappy. I mean, all of this is very crappy. But yeah. So next slide, please. Some anti-abortion lawmakers argue Texas's abortion ban from the early 1900s is still in effect and was never repealed as well. So it includes the following penalties, civil action by the mother, injunctive relief. I'm so sorry, guys. I'm so nervous. Okay. $10,000 to a $100,000 or more in fine. Physician's license suspension and being revoked, and felony charges, 5 years to life sentences. So obviously this is absurd, and these were the punishments and the penalties that they had in place from the 1900s, and they still want to try to argue that this can still be put into effect, right? So the only exception to this full abortion ban is the life of the mother, right? Next slide, please. So the trigger bill. In 2021, Texas lawmakers passed a trigger bill, which was designed to make abortion illegal in the state if Roe was ever overturned. Penalties for that included civil action, a minimum of $100,000 penalty for each violation, revoked licenses, permits, registration, certificates of the professional who performs, induces, or attempts to an abortion. First-degree felonies if the unborn child, right, dies, 5 to 99 years to be specific. Second-degree charges for other offenses, 2 to 20 years to be specific. So the only exception, to this full abortion ban is a medical emergency that causes death or substantial physical impairment to the pregnant person. Next slide, please. Next slide. I'm so sorry. Okay, so
This
abortion clinic.
Serena, this one's mine. I'll take
okay.
it for the abortion clinics. So thank you so much, Serena. I know all the legal jargon was hard, but you did such a beautiful job. So with that, as Serena was saying, that all these laws have made it really difficult for abortion to be possible in Texas, right? Most clinics have closed or relocated to another state. We are currently suggesting that people who text us to go to ineedna.com for an up-to-date list. But prior to Roe being overturned, there are 21 abortion clinics in Texas in the major cities like Waco, Houston, San Antonio, McAllen, El Paso, Austin, Dallas, and Fort Worth. Next slide. Also, we're big fans of Liberal Jane at JDP, so we included a few of their amazing graphics. Big fans. With that said, there's also a lot of abortion funds and practical support funds. Almost every abortion fund has currently closed for funding as a result of what Serena shared with the trigger ban and the pre-Roe bans. Buckle Bunnies is still like supporting callers, but the rest of our fellow funds have taken a brief pause to reassess for safety as we navigate our post-Roe reality. Next slide. But there are still national abortion funds. So the two largest abortion funds are NAF and the Planned Parenthood Justice Fund. This slide needed to be updated, but let me update it for you all in real time. So NAF will cover a portion of the cost of an abortion for people who qualify for support. So it's people who make under 110% of the federal poverty level. And Planned Parenthood also has a justice fund. They have certain qualifiers to be able to qualify for assistance. But for example, someone who was sexually assaulted and reported to law enforcement, they can have their abortion fully covered at Planned Parenthood. They do need to have the case number for it. Next slide, please. There's also national practical support funds like RAP, the Bridget Alliance, and Midwest Access Coalition. Because in this post-Roe reality, things change often, so it's really important to go to a website or to check their social media to see if they're still funding, as things can change and capacity is changing as well. But currently all these organizations are funding care for people who need support. Next slide, please. And parental involvement laws and judicial bypass. I will send this over to Serena, as she's the expert on judicial bypass.
Next slide, please. Thank you, Elle. Okay, so after Roe v. Wade, anti-abortion lawmakers passed state laws to chip away at the right to abortion. So one type of restriction is called a parental involvement law. In Bellotti versus Bayard, the United States Supreme Court held that states can require a parent or guardian to give consent or be notified when a minor seeks abortion care. But states cannot allow parents or guardians to entirely prohibit a minor from seeking abortion care. So the court created the judicial bypass process to allow minors a confidential way to obtain abortion care. Next slide, please. Okay, so what is a judicial bypass, right? A judicial bypass is an order from a judge that allows a minor to consent to abortion care without the notification or consent of a parent or parents or guardian. 35 states currently have parental involvement laws, including Texas. The process is completely confidential and all documents will refer to the minor as Jane Doe. And also, U.S. citizenship is not required to apply for a judicial bypass. Next slide, please. Okay, so how does JDP affirm people of different identities, to get a judicial bypass? So I can assure you guys that inclusive language is consistently used, sexual orientation and gender identity, data collection, intake forms have options for names used or whatever name you would like to use, and gender pronouns. Clinical services, staff knowledge of inclusive policies, partnerships with LGBTQ+ community organizations, and LGBTQ+ friendly referral lists. Next slide, please. So these are the types of questions that the judge asks when you are trying to obtain a judicial bypass. How did you first learn that you were pregnant? Were you using birth control at the time you became pregnant? If not, why? What are the top 3 reasons why you can't ask at least one of your parents for consent for your decision? Why do you want to have an abortion instead of carrying your pregnancy to term and giving the baby up for adoption, right? So those are the types of questions that the judge asked. They asked many more. Basically, you have to convince the judge, which this is already wrong, right? But you have to convince the judge that, you know, you're able to, or you can have the abortion without notifying your parents, or you don't have to notify your parents, or you shouldn't have to notify your parents to obtain a judicial bypass to obtain an abortion. So lots of convincing to do there, which is obviously not right, but that is the process. Next slide, please. Okay, so here is a timeline of how, or well, the average of how long the process takes to obtain a judicial bypass. So as you can see, the chart says, or the graphic says that the intake, right, from the intake to the ultrasound, that's 6 days. And from the ultrasound to the judicial bypass hearing is 15 days. So from the intake to the judicial bypass hearing, that's 15 days. And then to the abortion, that's 21 days. So for me, it didn't take this amount of time for me to obtain my abortion. It actually took longer because I got my judicial bypass in the midst of the beginning of the pandemic. So it took me way longer than this. And also, just so that you guys know, the bypass no longer happens in Texas, okay? But when it was available, this was the average timeline before SB 8 was passed. And also, just because you obtain, or not obtain, but just because you go to the court and try to convince the judge to give you the judicial bypass, that does not guarantee that you will get that judicial bypass as well. So it really does suck, the laws here, or the laws that were in place here, and then obviously the new laws also suck. But yeah, next slide, please. So what can you do? Next slide, please. So you can tell your community. Our hotline is 866-999-5263. So you can share that hotline with your community and basically spread the word, right? Encourage conversations about teens' reproductive rights with people around you. Know local resources that are sex positive and provide shame-free support to young people. Share the resource needabortion.org to help folks in Texas stay up to date on the abortion laws and how they can currently get support. Next slide, please. Also, be a non-judgmental resource. Listen, we aren't here to solve things. We are here to witness and guide towards healing. Validate and normalize. Seek understanding. Ask questions like, can you clarify that for me? What was it like for you to make this decision? Create space for reframing. Say things like, the fact that we're struggling with this shows me you are a really compassionate person. It sounds like you think this is the best decision because of whatever, right? And don't speak on behalf of young people, especially. Okay, censor youth voices, build youth leadership into programming. Okay, young people have this stigma that, young people cannot make decisions for themselves, or young people cannot speak up for themselves, but they can. We are people too. Okay, so definitely censor youth voices and don't talk over them or speak on behalf of them. Next slide, please. Elle, I will turn this over to you.
Thank you so much, Serena. I just appreciate all that you shared. And yeah, listening to young people. You can follow us on social media at janesdueprocess.org. This is one of the memes that we made with one of our former clients in the last cohort, of just reassuring and reaffirming that we are here and that young people are not alone in accessing care for abortion as well as birth control in a hostile state like Texas. Any questions? I guess we're done, Audrey.
Great. I will take it back. Thank you so much, Eleanor and Serena. That was amazing, and it's just a real pleasure to hear about the heroic work that Jane's Due Process is doing in Texas to ensure that young people are able to access the abortion care and the reproductive health care and information that they need to live their lives with dignity and autonomy, and just really solidarity with all of the difficult work that you're doing in a condition where a government has failed. So thank you. Just a couple of quick housekeeping notes before we go to questions, and any questions that folks have, put them in the questions tab. Really want to encourage folks to plug into Repro Action's campaigns. Sign up for our alerts at www.reproaction.org. Let me tell you why you really want to do that. There are a number of things. Like, one, you're not going to miss a thing. So if there's action alerts or events in your area, things to keep you posted on. But here's the deal. We run these Act and Learn webinars every single month, and they are free and open to the public, and you will never have to have FOMO or fear of missing out, because we send these invitations out every single month to our email list. So sign up. You will not miss an invitation. Also, to answer a popular question that was coming in, yes, we will be sending out a recording of this webinar and later posting a recording of this webinar on our website. And you can follow us on social media. We are Repro Action on Facebook, Twitter, and Instagram when we're not getting suppressed by big tech for sharing factual abortion information. And yes, we will come back to that another time. If you sign up for our list, we'll give you ways to take action on that as well. And before I go to the next slide, I'll pass this to Audrey if he wants to go through the take action piece.
Hey y'all, thank you so much for tuning in today, and thank you so much to JDP, both Serena and Eleanor, for presenting. So we just have a few tweets that you can send out just to give some more information about the importance of abortion care for everyone, and especially young people. So here are some examples that you can use. Yeah, so thank you so much.
Awesome. Thank you, Audrey. And I just want to say very firmly and strongly from a values perspective, it's so great to have this conversation today. Really appreciate Audrey's encouragement for y'all to get on social media and talk about abortion as healthcare for young people and really centering young people in this. We believe very strongly at Repro Action that young people are quite capable of making their own choices and should not have interference from government or others in accessing any form of reproductive health care that they want and need. So we respect the agency of young people, and we really salute our colleagues at fabulous organizations like Jane's Due Process that are doing this work on the ground and connecting people to care. Okay. Save the date for our next Act and Learn webinar. It's going to be awesome. It will be on Wednesday, October 18th. It'll be at noon Eastern, and we'll be talking about global solidarity to prevent maternal and infant mortality. So I'm really looking forward to that discussion. Hope to see you there. If you sign up for our email list, you will not miss that invitation when it is ready. So with that, I will move us over to Q&A. And as they come in, I will start with a comment from someone who noted earlier in your presentation, Eleanor and Serena, you had talked about how the Title X family planning clinics came through Nixon and said, thanks, Nixon. And someone wrote in and said, the only time I've ever seen someone thank Nixon, haha. And I will take a moment of personal privilege. Of course, Nixon was a crook, and that's a very astute observation. But it does actually point to something that's important to lift up about the nature of the moment that we are in terms of the crisis in access to reproductive care and political polarization on it. It was not always the case that the right was opposed to abortion. In fact, it was a manufactured issue that came about around the time of Nixon's tenure, and where there were some folks in a smoke-filled back room that were looking for a different issue to wedge issue to recruit right-wing voters in response to segregationism falling out of favor. So it really kind of connects back to themes that Audrey was bringing up in his presentation as well about how all this anti-abortion ideology and harm links in with replacement theory and really is rooted in racism. So thank you for that. Okay, this is a really interesting question for our colleagues at Jane's Due Process. Any idea what % of judicial bypasses in Texas cases were approved pre-Dobbs?
I can take that. We had about a 95% approval rate of winning our bypass cases. I think if that answers your question. I don't have the actual number offhand, but we did win the majority of our cases to get the bypasses granted, because the bypasses were like a young person had to apply in their county of residence unless their county was less than 10,000. That did provide, challenges in counties that had like a judge that just had more anti-abortion beliefs, right? So, but we did win the majority of our judicial bypass cases.
That's awesome, and got a great thank you back on that. I will just hold for another minute or two to see if there are any other questions, and I will just say I really appreciated in your presentation how you put right there on the screen and walk through exactly the questions that a judge would ask a minor seeking a judicial bypass so that someone can be prepared. And I will also just say I was both grateful you were putting it there and just infuriated at that total invasion in a young person's autonomy to have to speak to those issues in order to get the care they need. There's something fundamentally wrong when young people are being forced to do that.
Thanks, Erin. So like in response to that question though, we were talking a little bit about just the questions that are asked. If you listen to the podcast by our former clients, that's Jane is not a virgin, which is a pun on the fact that to get a bypass, you are no longer a virgin, but like that was just their way to joke about the process and find humor in a traumatic experience. You'll be able to hear more of like individual experiences with judges, specifically a judge in a conservative area from H.K. Gray. So I definitely recommend it. And also hearing inappropriate questions from progressive judges who thought they were, allies for reproductive freedom, but also said really harmful things. I think I said earlier that we had like a really good success rate on getting bypasses granted and advocating for teens. But just because a bypass is granted doesn't mean it wasn't traumatic. And you can hear those stories on the Jane is Not a Virgin podcast about what it was actually like to go through the bypass process. And even though they won their case, like there was still so much trauma that they experienced during the hearing.
Thank you for that. Well, we put that link in the chat. Eleanor had lifted that up, and we will also include it in our follow-up email that'll come out in a few days that will include the link to the webinar recording as well. So really encourage everyone to check that out. We're going to close now. I just want to say again, thank you, Serena, thank you, Eleanor, and thank you so much, Audrey Gao on Re-Pro Action's team for pulling this together. This has been really informative. Thank you. Goodbye.
Bye-bye.